Hello friends, today we are going to discuss about the puberty. It is not that much of important as far as the exam is concerned, so let's get started. What is puberty? Now, as far as the definition is concerned, puberty defined as a state of gonadal development and maturation to the point where the reproduction is possible for the first time. So this is the definition of the puberty. Puberty is the gonadal development and the maturation to a particular point where the reproduction is possible for the first time. So puberty is basically has a two components. First one is the sprout of the physical growth. So the sprout is basically height increase, then the increase the muscle mass, then increase the muscle strength. And the second portion of the puberty is the appearance of the secondary sexual character. Got it? Now there is one topic named as a secular changes in the pubertal age, right? Now what is secular? You already know. Secular means it is nothing related with the religion. So what is the secular changes in the puberty? So basically the normal pubertal age is concerned, as far as the girl is concerned, it is about 8 to 30 years, and in boys it is 9 to 14 years. So it is very easy to remember 8 and 9. But past couple of times, this age is getting decreased. What does it mean by getting decreased? Pubertal age is getting declined. What is the meaning of that? That's the pubertal age of girl, instead of 8 it may be decreased about 7.5 or 7.8 years. In boys it's become less than 9. So as the couple of centuries pass, the pubertal age will also decrease. Now it is decreasing at the rate of 1 to 3 months per decade. These changes of the puberty is known as the secular changes in the pubertal onset. What? This is the secular changes in the pubertal age. Now the secondary sexual character. Now as far as the male is concerned, the male secondary sexual character, we already discussed this particular topic under the male reproductive system. So this is nothing but a revision of that particular topic, male secondary sexual character, starting with the external genitalia, then the internal genitalia, voice, then the hair growth, then the mental development, then the changes in the body configuration, and finally the changes inside the skin, right? Now as far as the external genitalia is concerned, we have to mention two things. One is the penis, another one is the scrotum. Now as far as the penis is concerned, what happens to the penis? At the age of the puberty, the size of the penis is increase in the length and increase in the width. Now in the scrotum, there is pigmentation will occur more and rugosity will increase. Now as far as the internal genitalia is concerned, we have to write it down about two things. One is the seminal vesicle, prostate, and bulbourethral gland, if you remember from our previous lecture of the male reproductive system. Now as far as the seminal vesicle is concerned, it is basically enlarged and secrete its secretion, and prostate and bulbourethral gland will also increase in size and secrete its secretion. Next one is the voice. What are the changes that is taking place in the voice? So voice become masculine, hypertrophy of a laryngeal mucosal cell will occur, hypertrophy of laryngeal mucosa will occur, and finally enlargement of a larynx will take place. Now what kind of changes that will take place in the hair growth? Now as far as the hair growth is concerned, you already know about the male secondary sexual character is the beard will start appearing, pubic hair. There is a one particular configuration in the pubic hair, that is a triangle with apex up pattern. What is the triangle with apex up pattern? Let me show you this thing. See, in male the triangle with apex up pattern, and in female triangle with apex down pattern. In some book it is also written as in the reverse manner, that in male it is a base down pattern and in male base up pattern. So both are the same, but this one is I am taken from the Ganon. So remember that triangle with apex up in male, triangle with apex down in case of female. And general body hair will increase, male pattern baldness will seen. Right, this is all about the changes in the hair growth. Now what kind of changes will take place in the mental configuration? So the person as the male reach to the puberty and secondary sexual character starts getting increased. So what happens to the mental configuration? The person become more aggressive, and it has developed interest in the opposite sex. Now what kind of changes that is taking place in the body configuration? The first changes is the shoulder become broaden, and typical male pelvis will be seen, will be appear. The growth of the pelvis will be converted into the funnel shape of the pelvis. In case of female, it become ovoid shape. You already know from our male reproductive system lecture, muscular growth will be developed. And what kind of changes that is taking place in the skin? So as far as the skin is concerned, basically there is increase in the thickness of the skin and increase the secretion of a sebaceous gland, and it leads to the acne. Got it? It has something related with the testosterone. So acne is the most common feature of the male adolescent when the body is first becoming introduced to the increased testosterone. So don't worry, that acne that you seen in your face, all the boys, it is basically due to the testosterone. So acne is one of the most common feature in the male adolescent when the boy become introduced, or the first testosterone will be increased. And why this acne will be resolved after a certain period of the time? So after several years of the testosterone secretion, the skin normally adapts to the testosterone. So I do not allow to make acne over your face. Now the girls might be wondering that why they also face the acne. That acne that is seen in the female is basically due to the internal androgen. It is not due to the testosterone. Right? If there are more amount of adrenal androgen will be synthesized at the time of the puberty or after the puberty, whenever there is a higher amount of the adrenal androgen, there is higher amount of the formation of the acne. This is all about the male secondary sexual character. Now let's discuss about the female secondary sexual character. So the first features will be developed as a female secondary sexual character is the development of a breast or appearance of a breastbud. It is known as the thelarchy. It is basically the appearance of the breastbud. Second one is the pubarchy. Pubarchy is nothing but pubic hair development, axillary and pubic hair development. It is basically the apex down pattern will be start appearing. And the last features is the menarche. The female start or girl start menstruating. So these are the sequence of appearance of a female secondary sexual character. First the breast development will occur, then the pubic hair will develop, and finally the menstruation will start. Now let's discuss one by one. The most of the thing we already covered in our female reproductive system, so it is nothing but a revision of that particular topic of the female secondary sexual character. Let's enumerate the important topics that we are going to cover. First one is the feminine body configuration, changes in the skin. As I told you, skin becomes soft in our female reproductive system. Then the voice, changes in the voice, then the hair distribution, and finally the acne. So as far as the female body configuration is concerned, female distribution of the fat in the buttocks and breast, right? So if there are higher amount of fat, this fat is going to store over the breast and over the buttocks in case of female. Now that distribution of the fat is different in male. In male, mainly the fat distribution will take place over the abdomen. Right? Now the next one is the narrow shoulder and thigh converge and broad hips. So basically narrow shoulder and broad hips, thigh converge, and arms that diverge. Now what is the meaning of that thing? Whenever the thigh converge and arm diverge, that is known as the wide carrying angle. Now what is the wide carrying angle? That we already discussed in our female reproductive system. Let me show you the diagram. This one is the normal arm, when the arm is converged, it will be look like this. In the same fashion, thigh is going to converge in the middle. It is known as the thigh convergence and arm divergence. There is a wide carrying angle is the clinical features of a female secondary sexual character appearance. Now, as far as the skin is concerned, skin becomes soft inside the female, and there are less amount of body hair growth due to less amount of testosterone inside the female. So now next one is the voice. As far as the voice is concerned, larynx remain in its pre-pubertal proportion. So yes, voice stay in the high pitch. So this is the reason that because of their larynx is remain as the pre-pubertal age, all the female has a high pitch voice. So it might be very painful sometimes to hear a voice. Now the hair distribution, less body hair and more scalp hair, pubic hair with a flat top up pattern. This is the base up or flat top or the apex down pattern. Now as far as the acne is concerned, there are increased fluid secretion in the sebaceous gland. There are more amount of fluid is secreted in the sebaceous gland, less amount of mucus fluid secretion. So there are chances of the blockage of that sebaceous gland is decreased, and basically it inhibits the formation of a acne. Alright. Now here's the important thing, that is how pubertal onset will occur. Now according to a book Hindu Purana, till puberty, GnRH secretion from the hypothalamus, it is highly sensitive to the feedback inhibition of the sex steroid. But till puberty means before the puberty, before appearance of the puberty, GnRH secretion, that is from the hypothalamus, from the medial preoptic nucleus, it is very highly sensitive to the feedback secretion or feedback inhibition of the sex steroid. That sex steroid is basically secreted from the adrenal gland, and the sensitivity of a hypothalamus is progressively decreased from birth to the puberty. Right? Now this is one theory that is given by the Hindu Purana. Now according to the Gannon, pulsatile release of a GnRH is responsible for the puberty to occur. Pulsatile release of a GnRH is responsible for puberty to occur. Now we want this GnRH in pulsatile manner. If you continuously infuse the GnRH, then puberty will not appear, because this pulsatile release is responsible for increase in the secretion of LH and FSH. Right? Now this pulsatile release is actually inhibited initially by GABA, opioid and melatonin. Now this pulsatile release is going to stimulated by one particular peptide, it is known as kisspeptin, and the next one is the glutamate. Now this kisspeptin is basically initiate the pulsatile release of a GnRH. So remember, kisspeptin is basically responsible for onset of a puberty. So at the time of the puberty, according to the Hindu Purana, hypothalamus is no longer remain highly sensitive to the sex steroid. It is going to release GnRH in good amount. It leads to increase FSH and LH from the adenohypophysis or anterior pituitary. This increased FSH and LH is going to enter inside the blood and reach to the gonads, and it acts on the gonads and release gonadal sex hormones, and pubertal changes will start due to this gonadal sex hormones. Right? So according to the Gannon, pulsatile secretion of the GnRH is going to bring the puberty. Now it is not that only pulsatile release of GnRH is responsible. This puberty is also getting affected by a leptin. Now what is the role of leptin in pubertal onset? So there is one finding that when a young woman, when they lose weight, it often stop menstruation. If any young women, when they lose weight, too much lose weight to make a zero figure, sometimes they often stop menstruating, and they resume menstruation when they regain weight. So there might be a particular link between the critical body weight is required for menstruation. So critical body weight is actually required for the pubertal onset, puberty to occur. Now this fat or adipose tissue that is present inside that female, it secretes a hormone known as leptin. So what is leptin actually? Leptin is nothing but a hormone that is secreted by the fat cell. So leptin is actually the hormone that is secreted by the fat cell. It acts as a link between the body fat storage and the onset of the puberty. It signals the adequate body store to the center and aid into the GnRH pulsatile release. Got it? And this role of a leptin in GnRH pulsatile release, it is known as the permissive role of the leptin. Got it? So what is the permissive role? We already discussed the permissive role. It actually do not affect its thing, but some amount of that particular hormone is required. Right? We already discussed the permissive action of the cortisol. Right? In order to action of a catecholamine. If you remember that the corticosteroid is actually not acting through this catecholamine, but small portion of a corticosteroid must be present in order to do the work of catecholamine. So corticosteroid is going to give a permission to the catecholamine to do its action. So in the same fashion, this one is the permissive role of a leptin. So permissive role means the leptin is actually do not causes the GnRH pulsatile release, but it aid or small amount of leptin is required to initiate GnRH pulsatile release. So what is the role of leptin? So more fat cell, it leads to more leptin secreted. Now this more leptin is act on the hypothalamus, and this hypothalamus will stimulate the GnRH release. So the critical body weight is actually required to the onset of the puberty. So actually GnRH pulsatile release is done by kisspeptin, but in order to act of the kisspeptin, in order to increase the pulsatile release of the GnRH, the permissive role of the leptin is needed. Right? So there might be a tendency to in exam there might be a new comment that may be asked that leptin is required for puberty, or what is the role of leptin itself, or how the leptin or how the body fat will influence the onset of puberty. There are tendency, there might be chances, there are new comment might emerge from this particular topic. Now this is all about the puberty. Now what are the disorder of the puberty? Now as far as the disorder of the puberty is concerned, there are two type of disorder in the puberty. In one disorder, puberty appear early. In the next set of disorder, puberty will be appear late. So puberty which appear early, it is known as the precocious puberty. It is basically the early onset puberty. So what is the precocious word mean? Right? Precocious, exact definition of the precocious is that ability to develop whatever the thing earlier as than it usually expected. Let me repeat one more time. Ability of having developed at an earlier age than it usual or expected time. It is basically early onset puberty. This early onset of puberty is basically two types. One is the true puberty or precocious puberty, another one is pseudo precocious puberty. The next set of disorder as far as the puberty is concerned is the late puberty. There is a delayed puberty or the late onset puberty. So let's discuss this one by one. True precocious puberty. Now what is the true precocious puberty? The meaning of true precocious puberty is that the puberty is actually present with all its character, but it's early. Got it? So what actually happens in the normal puberty? There is increased GnRH. This increased GnRH will leads to increased FSH and LH. This FSH and LH will ultimately leads to gametogenesis and secondary sexual character. So two things must be present in order to fulfill the definition of the true precocious puberty. One is gametogenesis is there. Second one is secondary sexual character is there. Right? This is the difference between true and pseudo precocious puberty that we discuss in later. So true precocious puberty, there is a early GnRH secretion. That early GnRH secretion will ultimately causes the gonadotropin dependent precocious puberty. Now in this true precocious puberty, there is a presence of the gametogenesis and there is a presence of secondary sexual character. So whenever puberty is early onset plus gametogenesis is there and secondary sexual character is there, then and then it is known as a true precocious puberty. Now what is pseudo precocious puberty? Now you know the meaning of pseudo, right? It is not actual or it is not true, it is known as pseudo. So in pseudo precocious puberty, secondary sexual character is there. There is a appearance of secondary sexual character is there, but no gametogenesis, no ovulation is there, no spermatogenesis is there. So basically this type of pseudo precocious puberty in which secondary sexual character is present but gametogenesis is not there, this type of precocious puberty is not due to increased GnRH secretion. So how that kind of puberty will occur? That puberty will occur due to early exposure to the sex hormone. Now how that early exposure of the sex hormone will take place? So there are the disease that we already discussed in our adrenal cortex series of lecture number 4 and lecture number 5, congenital virilizing hyperplasia, androgen secreting tumor in male and estrogen secreting tumor in female. Now if you are wondering what is the androgen secreting tumor, what is congenital virilizing hyperplasia and how it leads to increase sex hormone, I already discussed in very detail in cortisol, the adrenal cortex series lecture number 6. So go through that lecture. So what is the delayed puberty? There is a second portion of a disorder in the puberty, delayed puberty. How much delayed? In case of female, if there is no menarche by age of 17 years, and in male no testicular development by the 20 years of age, then it is known as delayed puberty. So what is where the fault lies? If the failure of hypothalamus or the pituitary level, then there is no gonadotropin secretion will occur. If there is no GnRH, there is no FSH and LH, and they do not work over the gonads to produce sex hormones. So puberty is delayed. So the reason of failure of hypothalamus and pituitary, one of the causes is the panhypopituitarism. All the hormone that is secreted from the pituitary get decreased. Second feature or second cause of this delayed puberty is primary gonadal failure. There is a gonadal dysgenesis. The gonad itself are not developed up to the mark that they are enough to secrete enough sex hormones. What are the causes of the gonadal dysgenesis? Klinefelter syndrome in case of male, Turner's syndrome in case of female. Now what is Klinefelter syndrome and what is Turner's syndrome? You already know, right? It is already covered in 12th standard. Now, yes, menopause. This particular topic it is actually asked once January 2015. So what is menopause? Menopause at the age of 45 years, menstrual cycle ceases and there is decreased production of a sex hormone. Alright, at the age of 45 years, menstrual cycle ceases and there is decreased production of a sex hormone. Why there is decreased production of the sex hormone? Because sex hormone is actually produced via ovarian follicle and the corpus luteum, right? So why there is decrease in the sex hormone production? Because primary follicle that are present, they become atretic. The growth, this primary follicle now no more tendency to increase its size, converted into the primary, then the secondary, then the antral follicle, then the Graafian follicle. So primary follicle lost its capacity to regenerate or to increase its growth, and it become atretic. Now once it atretic, ova become degenerate. So throughout the female reproductive life, female will secrete about 400 of the primordial follicle that grow into the mature follicle, into the Graafian follicle and ovulate, and remaining of hundreds of the thousand of the ova is degenerate. So once this ova will degenerate, so ovum development does not occur, production of estrogen by the ovary falls to zero. As the production of the estrogen is not there, there are no more inhibition of gonadotrope LH and FSH. So basically there is decreased inhibition of FSH and LH at the pituitary level. So what it leads to increased FSH and LH production after the menopause. Yet this higher amount of FSH and LH is not able to grow any follicle, any primordial follicle into the mature follicle, because all the primordial follicle are atretic or all are degenerate. So this is one of the features of the menopause. There are in higher amount of FSH and LH all the time. So there is one comment asked from this very particular topic, that is at the onset of the menopause FSH and LH level remain constantly high. You have to write it down all the things that we mentioned in our previous slide. That is at the age of 45 years menstrual cycle ceases, there is decreased production of a sex hormone because of the primordial follicle become atretic, ova degenerate. So basically the ovaries are not able to synthesize enough amount of the estrogen, so there are no estrogen. It will lead to decrease or decrease inhibition of FSH and LH and increase FSH and LH production after the menopause from the adenohypophysis. Now what are the signs and symptoms of a menopause? Now average age of onset of the menopause is 52 years. That particular figure I taken from the Gannon. So stick to this 52 years. Average age of onset of the menopause is 52 years, and this result due to the estrogen deficiency. This is the main cause of the menopause. As the ova become atretic, ova degenerate, there are no more formation of the mature follicle and no more synthesis of the estrogen, and ultimately there is increased FSH and LH secretion. So the first symptom is the hot flushes. What are the hot flushes? Hot flushes means the sensation of the warmth spreading from the trunk. Now these hot flushes will correlate with the LH pulses. Now night sweats will occur, the increase in the sweating during the nights. There are increased risk of the many diseases such as osteoporosis, ischemic heart disease, and finally the renal disease. All these diseases are decreased during the enough amount of the estrogen. So whenever there is estrogen deficiency, no more protection from the osteoporosis, no more protection from the ischemic heart disease, and no more protection from the renal disease. Its protection will wear off, and female has a tendency to suffer from the osteoporosis, ischemic heart disease, and renal disease. Next thing that we'll see is the vaginal epithelium become dry. So they're basically the painful during the intercourse. So what might be the treatment of this menopause? Treatment is very simple. Its main cause of appearance of the menopause is the estrogen deficiency. So if you give enough amount of estrogen exogenously, then most of the symptoms will wear off. So how will you give estrogen exogenously? That particular treatment is known as HRT, that is hormone replacement therapy. Alright, that's it for our today's lecture. Thank you.